Every Woman presents what every woman and man should know about choosing the right breast cancer facility. And Dr. John Link, welcome to the show. So let's talk about why you started BreastLink and what it is.
Okay. We both are dedicated and passionate about taking care of women with breast cancer. And we both, at about the same time, realized that to do it properly, you needed a whole group of doctors and support system to take care of a woman with a newly diagnosed breast cancer. And John West was doing this down in Orange County, and I was doing it as a medical oncologist. He's a surgeon. As a medical oncologist, I established a breast center in Long Beach. And then we were fortunate enough a few years ago to combine our, I hope, talents, I think so, and create what I think is the best breast center, a way of taking care of women with breast cancer anywhere.
So how did that dialogue start between the both of you?
Well, we were, as was stated, we were two of the pioneers. So we had a
pioneers. That's a title.
We were really
young pioneers.
Yes, right.
But we had been talking all along because we were doing research, we were collaborating. We wrote a paper together 10 or 15 years ago.
What was that paper?
It had to do with a report card helping other physicians taking care of women with breast cancer, looking at how to do it properly and how to measure that you were making improvements.
What makes BreastLink, because you said you think you've created something that's fabulous, and you have, what differentiates BreastLink from all the other centers? What makes it so great?
I think it's that all of us in our facility are dedicated to one goal, and that's taking care of women with breast cancer. We're not doctors doing melanoma, internal medicine, other types of surgery. We made an early decision that we were going to take care of one disease and do it well, and we realized that it took multiple disciplines. It just no longer was a surgical disease. It required medicines and treatment and plastic surgery and radiation.
So, Dr. John West, I'd like to talk about what the need was for this facility.
Well, let me tell you about a story. It kind of takes it from the other point of view that John described. I had a woman come to me in January, 4 months into this breast lump, and she needs the diagnosis. I said, well, what could possibly take so long? Well, she found the lump in September or October, called her doctor, took her a couple of weeks to get in, and then it took a couple of weeks to get the mammogram, and then they had to bring her back for additional views, and then finally they finished, and they sent the report to the doctor. She had to wait to get into the doctor, and the doctor says, you need a biopsy.
She probably had HMO insurance.
Well, no, that was more the way, it was just totally disorganized
right.
in those days, and I said, you know, this just isn't right. This is
well,
not, the anxiety is
progressing because of the anxiety and the stress in this waiting game.
It's terrible, and there are some cancers that really do grow so fast that a delay can make a big difference. But think of, even if this is a benign lump, the woman is suffering this time, thinking they're filling out wills. They're worried about who's going to take care of their kids when they pass it. It's not rational in most cases, but that's the kind of pressure women are under.
So, Dr. West, it sounds like you wanted to create an experience.
Right.
You wanted to create an experience. Would that be safe to say that?
I think an experience that said, I am confident when I make that call to the center, they'll see me within 24 hours. They'll see me by the imager that can do a complete imaging workup. They'll see the surgeon. We'll do a complete surgical workup. We'll recommend a specific biopsy if that needs to be done, schedule it. Sometimes the patient will come in with an advanced aggressive cancer. I call Dr. Lincoln. There's not much I can do, but he walks over from his office and talks to that patient. Wow. Next day she can be on chemotherapy.
Not only is BreastLink efficient, but it's pretty. You know, it seems like it's almost like this relaxing, soothing atmosphere for these women who come in who are terrified. Right. Why did you design it that way specifically?
Well, we had help.
But the women told us what.
A lady come in and did you get
well, I think, you know, we wanted the women to come in and feel a sense of being cared for and confidence and something designed for them and something that was efficient but friendly. And we have a shop on Main where they provide support garments and various wigs and things like that. And poor women,
on site?
Right on site. And when the women who are just diagnosed are under such stress, and the worst thing sometimes is the thought of losing their hair. and they go into this center where they have volunteers that have been there, done that. And sometimes they'll spend hours getting support from those women, input. And they say it's such a reassuring thing to be within kind of a family where the staff understands where they're coming from, the doctors talk to each other and get things
and that's
done.
critical. I mean, it's really
That was one of the things I really thought was wonderful that I heard is that you created a support system, built-in support system that's not just the doctors, but it's also our former patients.
Right.
And was that way from the beginning?
Pretty much so. You know, I'd like to make just one point, and it still happens outside of our system, and that is women with breast cancer are treated sequentially.
Right.
They'll see one doctor, they'll see a surgeon, he'll do everything he needs and wants to do, then he will pass the patient on to the radiation doctor, and then passed on to the medical oncologist. And there's not the collaboration. We believe that every woman with a newly diagnosed breast cancer should have all the specialists go over her case together before we launch any treatment.